Contractors of Colorado. It is your host, Andrew Laverns, with another episode of the Contractors of Colorado podcast. Our guest today is Miss Jordan Davis with the Davis Team Advisors. Before we get started, as always, a quick shout out to our sponsors, Builders Outlet, for all your trim cabinets, windows, doors, and any custom millwork that you might need. They are our sponsors here, and they're one of our favorite suppliers in the area. So if you're in Denver and have any of those needs or the surrounding areas, they will ship them directly to you. And tell me with the Contractors of Colorado. They'll help you out. And then, as always, the Business Foundry. I am one of their incubated businesses in the Business Accelerator. They help with everything from my website to social media management, my business plan, my roadmap, my financial advising, everything that I might need for my business, they help me out with, and they've created a program to help contractors like all of us in this audience. So please reach out if you want any of that information. They're here to help. Jordan Davis, how are you doing?
I'm good. How are you?
Good. So Jordan Contractors is one of my favorite people. We've known each other for years. She's a handful, but she is a great member to have in this verified affiliate community. She takes care of all our health insurance needs. But before we jump into straight business, tell us about yourself. I met your family. They're fantastic.
Yeah, we've done some traveling. So I work all the time. Recently, I don't have a lot of hobbies or interests at all because my child just started kindergarten. So all of my free time that I'm not working is now figuring out play dates and sleepovers.
Yes.
Because that's very important for a 5-year-old.
Very much so. Do you have a shoe addiction?
Yes. So I do work for Shoes and Vacations. I have a problem. So it's very important for me to continue working so I can continue buying shoes and going on vacations.
Name me one other health insurance broker that's as dedicated to their craft as you without some sort of incentive, and for you it just happens to be shoes and vacations.
Yes.
Awesome. Well, thank you for being here. It's really great having you. I guess let's talk about some of what you do. The Davis Team Advisors, you're a health insurance broker. Mm-hmm. Tell us a little bit about your role.
Yeah, so we're a health insurance brokerage. So we help individuals, families, businesses. I don't do a lot of Medicare, but I got some really good contacts for Medicare. But yeah, we're just kind of a full service brokerage, making sure that people are taken care of because health insurance is not a fun world and it's confusing. So you need somebody to guide you through it.
How long have you been doing health insurance, serving the Colorado area? I know you're licensed in some other states as well, so you can help out family and friends of our contractor pool. But how'd you get started?
Yeah, absolutely. So next month will mark 4 years that I've been in the health insurance industry. I've been working in Colorado, obviously, for the last 4 years and all the surrounding states across the country. And I kind of moved in this industry because I've been on the bad side of health insurance with me medically just as of late, the last few years. But prior to that, what drug me here is because I experienced the bad coverage options that my mom had working for a university for a long time. And then when she got sick, it didn't cover PET scans, it didn't cover second opinions. I was having to fight to get the right amount of Oxycontin or painkillers because they would only cover 9 pills a day. So it was just kind of a nightmare. And my family of 3 were paying $1,800 a month for insurance that didn't cover anything. And the only reason we got out of it the way we did was because of the connections that we knew. And your average person is not that way. So I wanted to move into an industry where I could actually help educate and make sure people land where they need to when things happen and not be afraid to use your insurance. You shouldn't be afraid to go to the doctor.
Yep. It's your approach is your story of getting here is one thing that's inspiring because it's not every day. A lot of people get into this just because it's something they stumble into or think it's a good option for them, but you actually had some drive and motivation to get involved in this because you've experienced the bad side of what health insurance can be.
Yeah, absolutely, because it's not it's not a fun industry to be in, but it's important to have people that know what they're doing and understand the newest legislation. They understand the new rules that are coming down and all of the ins and outs of it, because nobody should have to know all of that.
Yeah.
On a regular basis.
It's a huge piece of our verified affiliate program is this is a community we put together of experts that contractors can trust. Not this is somebody who just stumbled into it, but this is somebody who has made a life around this and is trustworthy. So thank you for being here. Thank you for being a part of that program.
Thanks for having me.
Tell us about your approach.
So I kind of take everybody's scenario on an individual basis and just kind of look at the whole picture. So if we're looking at a big group or we're looking 200-300 employees, we still try to look at on an individual basis, as well as down to your like single individual 1099 self-employed contractor, figuring out what everybody needs and then building plans around that, because everybody's healthcare journey is going to be different. Everybody needs something different. You need something different than your wife needs, than your son needs. I need different coverage that my husband and my child need, because they're extremely healthy and dumpster fire here. So I need something a little bit more robust and things that are going to work a little bit better.
Yeah.
So.
Are there any specific strategies when working with the contractor community? I know you've helped out lots of this community before and already, so thank you for that. But is there anything that you would want to share with the contractors specifically about choosing a plan or going through everything?
Yeah, so specifically, a lot of the contractors seem to not have insurance whatsoever because they feel like it's just expensive. And it doesn't always have to be expensive. There's a lot of options out there. And again, making sure they have what they need. Contractors have accidents. I mean, my husband was a contractor for several years doing remodels, and the amount of accidents, or hiking, you fall out of a tree because you're trying to climb a dead tree. You know, you do stupid things, you get hurt, you need coverage. My daughter's first day-ish of school was yesterday, and literally she fell off the monkey bars and sprained her ankle. So not something I was expecting, but you need to make sure you have the right policies in place to protect your financial future. And if you're a contractor, more than likely you work, you do a big job, you get a big chunk of money, and then you're waiting until you finish the next job, and you get a big chunk of money. What happens if something happens to you, and now that big chunk of money is now owed to a medical bill that you were expecting to live on for the next couple of months until you completed your next job?
Yeah, that's the nature of being a contractor. Contract work, 1099 by nature. So whether you're the individualized employee that isn't being offered any sort of health insurance, you're a great person to connect with, or whether you're a business owner, where a lot of business owners go straight to, well, I can't afford this for my guys. I only have a crew of 6 maybe full-time, or maybe they're all 6 1099. You're like, I can't even provide them with health insurance. One of the things that we've talked about before is that you don't necessarily need to offer a group policy to bring health insurance to the table for your employees.
No, and you also can just add a resource to your contractors or your couple of employees, because unless you have 50 full-time employees, or if you have 10 full-time employees and 45 part-time employees, that still equates to the amount of 50 full-time employee hours. So then legislation gets a little bit different, and you have to offer different types of plans, right? But if you're under that threshold, there's options that you can look at. There's ICRA, there's a lot of different things that you can do and business owners can do to bring value so that their employees or their contractors are happy and will stay working with them, because training an employee is expensive.
Oh, yeah.
Any business owner knows the biggest expense is employees.
Yes, and a lot of the headache comes from employees too. So if there's something you can bring to the table is even just an introduction, or I tell guys all the time when they ask about health insurance, all right, you don't have enough full-time guys to even consider offering a group policy, but what you can do is buy them all lunch, sit them down, put them in some air conditioning here at the Business Foundry, and Jordan will come out and educate them on health insurance, and it'll take half an hour to an hour, and then they can walk away, and you as a business owner, in their minds, have facilitated them getting healthcare options, which is a very close margin to providing the healthcare yourself. So,
well, yeah, and the business owners too. A lot of the contractors, and some of them aren't quote unquote legal, but there are still options for people that are not, U.S. citizens or green card holders that hold a Social Security card. There are options out there for those people as well. And I know that's a big struggle, and people are afraid to talk about it because they don't want, the bad stuff to happen. But that's where I don't really care what people do for a living. It's completely judgment-free space. I just want to help educate and make sure they're in the right spot.
Awesome. A couple more questions for you. Is there any emerging trends you see in the healthcare world, I guess specifically relating to contractors or just in general that you would want to share with the audience today?
Yeah, so a little bit, but legislation in any big election is going to make changes in healthcare. We don't know what they're going to be if we stay Democratic or if we go Republican. There will be changes in healthcare, so we just need to look out for that. But when it comes to, especially here in Colorado, we are not part of the federal exchange. So if they're going to a state-based plan, we're part of a state exchange. And just on trend and market for the last several years, those plans out-of-pocket maximums have gone up anywhere between $250 and $300 out-of-pocket per year. And we're we're just under $10,000 we will be for January plans. So, know what you have, know what you don't, know that there's supplementals out there to protect them and their out-of-pocket exposures, because nobody wants to give $9,700 or $9,500 to insurance company. Ever.
Yep.
Again, shoes and vacations.
There you go. Yeah. Contractors, if you're like I am, where a lot of this is just like, I've heard those words before that you've said, but I don't know what they mean. And no, I don't want to know what they mean.
Correct.
That's where you come into the picture, is you can be an advocate. I've recommended you to my parents when they retired. So, there's definitely a trust factor here. There's a reason why you're here as a verified affiliate. So thank you.
Yeah, absolutely.
Any final thoughts for the contractors today?
If you're losing Medicaid and getting kicked off of it, get a hold of me. If you are looking to go self-employed and kind of do the contractor thing full time, get a hold of me. There's some options that we can take a look at. Don't necessarily take COBRA. COBRA is not always the answer, because COBRA is very expensive and you can use that money elsewhere that's already been spent. So just make sure you know what you got. And my services are always free too. So insurance carriers pay me. The people I'm helping do not pay me a single dollar.
Yep. Well, again, thank you for being here. Yeah. One of my favorite verified affiliates and just people in general. It's been a pleasure to know you and work with you over the years and have you really support this community. The amount of people you've already helped it doesn't go unnoticed. So I'm excited to be able to kind of put you in the spotlight here, literally, and
making me do things I don't like to do.
Exactly. Yeah, Jordan she's a fun one too, contractor. So please take her out, go get some margaritas, and learn about your health insurance. I don't know, but somehow you make it fun to learn about things that I have no desire to learn about. So again, thank you.
Absolutely. Thanks.
All right. Well, that's it for today, contractors. Really appreciate you. One more shout out to the Builders Outlet for all our material needs. If you're doing any rehabs, fix and flips, if you're doing new construction even, or just need materials to go put in a new door, or you're painting, want to do some trim work on the house as well, they will take care of us. So mention that you're from the Contractors of Colorado. And then as always, big shout out to the Business Foundry, our host of all of our events. Don't miss out on our networking groups. We have our general contractor course up and running, and we are continuously enrolling for our monthly signups. So please, if you're interested in earning your license as a general contractor, reach out. We're happy to give you the information on the course. Other than that, contractors, that's it for today. I'll see you next time. Have a good one.